why a public option is necessarily going to destroy the private insurance industry. It's actually very simple. A public option essentially is a non-profit insurance company that's operated by the government. Now, do we know any government entity that is actually run more effectively and more efficiently than a private entity in the same industry? We really don't. The best example that President Obama was able to come up with was the Postal Service. Now, the Postal Service is $7 billion in the red for this year alone. Postal Service is a disaster. It does provide some kind of quality of service, not stellar, but it's definitely not making money. Okay? What happens to the Postal Service? The Postal Service gets subsidized. The hole gets plugged. Who picks up the check? We do. They cannot run Postal Service as a business. They keep losing money. Here's the thing about Postal Service. Nobody shuts it down. Imagine shutting down the Postal Service. Huh? Nobody would shut it down. Just because it lost $7 billion. Who cares? It's a vital service. We're not going to shut it down. Well, imagine, the same will definitely apply to a national health plan. A national health insurance company, I'm willing to bet money that it's going to lose money and lose it big. Okay? It's going to run into debt. Because if it doesn't, you see, the claim is, well, the private insurance companies are not being run efficiently. There's a lot of waste, and we can eliminate that waste. Plus, they take our profit. We're not going to take our profit. They advertise. We're not going to advertise. Okay, grant you that. But here's the thing. If it's going to be priced cheaper than the private insurance plans, that it's going to price them out of business. Okay? If it's not going to provide more for less, all right, if it does provide more for less, then it's going to price them out of business. If it doesn't price them out of business, it's going to lose money. And when it loses money, it's going to get subsidized. Now, Barack Obama said, absolutely not, it's not going to get subsidized. Do you believe that? Think about it for a minute. I know he said it. I know he's said many things. Politicians have said many things, you know. When they first introduced Social Security, they said that it's never going to be used for identification purposes. It's just Social Security. When they first introduced income tax, they said, "Oh, it's only this rate, and that's all you're ever going to pay." When they first introduced Social Security, same story. They said, "Oh, it's only this rate, and only for so much of your income. You're never going to pay anything more than that." Yeah, right. We know how that worked out. So they can say whatever they want to, including Barack Obama. All politicians can say whatever they want to, but the reality on the ground is such that a government program of that scope and scale and of that kind of importance to the citizens is going to get subsidized if it starts losing money, okay? And it will lose money, trust me. It will lose money. See, you can hear all sorts of things about Medicare and Medicaid being more efficient with administrative costs. Yeah, right. That is a myth that needs debunking, but that's a separate story, and there's actually a lot of good material on the internet if you know where to look. But Medicare and Medicaid routinely underpay providers. They basically dictate the rates that are many times below cost for healthcare providers, doctors, hospitals, and such. And they're still in the red. They're still trillions of dollars short. They're going to run out of money very soon. Okay? And that's not something that the GOP has come up with. It's the official scoring of the government. So they don't have any administrative costs. Quoting them, if we are to believe them, they have low administrative costs. They underpay providers, and they're still in the red. They're losing money. By the way, I get so mad when I hear people talk about Medicare and Medicaid as some kind of a success story. Well, people are very happy with Medicare and Medicaid. That's an example of a successful government program. Now, if I stood on the street corner and gave out money to people just passing me by, just gave out money, that would be a very successful program with those people. But it would not be sustainable because the money would have to come from somewhere, and you cannot just keep giving people money and consider that a success. Same goes for cash for clunkers. Same goes for Medicare and Medicaid. It may be liked by the recipients of the program, but it's losing money, and it's putting us everybody into debt, and it's raising our taxes and it's raising our debt. So I don't know how you can honestly consider anything like that a success. So if history is any indication, and it should be, then A government-run bureaucracy like that is absolutely going to lose money, and when it does, the taxpayer will be made to pick up the bill. So all this talk about no, the government option is not going to be subsidized. It will be, and therefore it is not about competition. If you're subsidizing one player and to help them price everybody else out, it will crowd out everybody else. It will price the competition out of the market. So that should make it obvious for you. The government option, in any way, shape, or form, if it comes about, is going to destroy, or at least decimate, the private insurance industry. See you soon.